Hello friends, welcome back. My name is Dr. Vijay Bhatia. I work as a psychiatrist and today we are going to discuss about post-traumatic stress disorder. What is post-traumatic stress disorder? It arises as a delayed or protracted response to a stressful event or situation of either brief duration or long duration, of an exceptionally threatening or catastrophic nature, which is likely to cause pervasive distress in almost anyone. Predisposing factors such as personality traits like compulsive personality or asthenic personality, that is more anxious personality, or there's a previous history of neurotic illness, may lower the threshold for the development of the syndrome or aggravate its course, but they are neither necessary nor sufficient to explain its occurrence. Typical features include episodes of repeated living of the trauma in intrusive memories like flashbacks, dreams, or nightmares, occurring against the persisting background of a sense of numbness and emotional blunting. Detachment from other people, unresponsiveness to surroundings, anhedonia, and avoidance of activities and situations reminiscent of the trauma. So what we are talking about here is exceptionally catastrophic event like war, like somebody kidnapped for ransom, somebody's having a threatening experience in the war, or severe car accident or rail accident or aeroplane accident where they survived, and this would have caused pervasive distress in almost anyone in that situation who has witnessed or been in that situation. And if the person already has some predisposing factors like weak personality, or they are suffering from some kind of anxiety disorders, depression in the past, or some kind of anxiety disorders, they will tend to suffer more. And the symptoms include the reliving of the trauma. So the person is actually visualizing, hearing the sounds, seeing the fire, hearing the gunshots, or visualizing the train crashing or the serious car accident where somebody died, or even sometimes the person may be attacked in the street or in their own home by intruders or by someone, and hurt them physically or killed somebody in the family, or even attack them with a hammer or something very serious where they needed a surgery. They keep on reliving that moment in their memories. And these memories are intrusive, and that's why they are called flashbacks. So the person has no control. They can get triggered from any clues, or even sometimes thinking about them or not thinking, just being in that situation, or some picture or some imagination, or even somebody asks them how was that experience or something, that can bring the actual reliving of the trauma in intrusive memories, which is called flashbacks. Or they get dreams at night, even during the day when they nap for a few hours. They get the dreams about the same scenario as if they were in the war or in that actual situation. Or they get nightmares, meaning they will wake up in the within the few hours they went to sleep with some kind of autonomic arousal, with a lot of anxiety, staring, feeling tense, eyes quite wide open. So they get nightmares of the same event, or even other nightmares that somebody is going to come and hurt them again. And these are occurring against the persisting background of a sense of numbness. They feel as if they can't feel anything. They are emotionally blunt. That means they are not reacting. They're just living in their own world with those kind of dreams and reliving them, not sleeping well at night because of the nightmares and dreams. They just feel numb. Their mood is just anxious, worried, and flat. And they are detached from other people. They don't like meeting other people because they might feel threatened, or might feel that they will be asking similar question or some related to the incident, and that will trigger the reliving phenomena. And sometimes they appear even as if they are unresponsive to the surroundings. If there is festival going in the town or within the family, they will try to avoid that gatherings. They are detached from the surroundings, and they develop no pleasure. Anhedonia means complete loss of pleasure in literally everything. Whatever they used to love and enjoy, that enjoyment, that pleasure is gone. They don't like anything. They just feel that there is nothing there, no pleasure in anything. And avoidance of activities. So if they don't like those activities, they don't get any pleasure, and therefore they will not even try. They will in fact avoid going to those activities to do some enjoyment. And they will avoid the situations reminiscent of the trauma. So if the car accident happened, they will not even go and sit in the car, or if it is not that severe, they will not go on the road, or they will not even sit on the front seat, or they will not even sit at the back seat, and refuse to go on the road at all, or travel anywhere outside. So depending on where the trauma is, it can be very devastating and making them quite dependent and not able to function the way they would have functioned before the incident of trauma. There is usually a state of autonomic hyperarousal. That means the pulse is going high, the breathing is high, there is muscle tension, some sweating, some kind of looking for, as if they are in a fight or flight mode, and they're hyper vigilant. They will be looking at if there is any sound which might be similar to the one that was involved in the trauma, like in the war. If they hear any sound that might sound like as if a bomb is going on or firing is going on, so they will be very vigilant. And enhanced startle response. Startle response reaction means they get very much scared of literally anything, even a slight shutting of the door with a loud little bit noise. They get very startled. That means their autonomic activity increases with the sometimes sweating, breathing, muscles getting tense, not able to breathe properly, sometimes even feeling sick. And they also complain of insomnia, that they have difficulty in going to sleep, and even if they go to sleep, they keep on waking up after a short period, sometimes with the flashbacks, other times with nightmares, and those memories they can't get out of their head. They are quite intrusive. A lot of the time these people go into depression and suffer from anxiety, and they are commonly associated, which must be actively treated with the psychological and medications. They may develop suicidal ideation, and this is not infrequent. This can happen, and these people actually go and do something because they get fed up over a period of time. When things are not improving, things are getting worse, and the intrusive thoughts are too much. The onset follows the trauma with some latency period. So in the moment the trauma is there, at that time they might have acute stress disorder, which is a brief period of numbness, of poor attention, poor concentration, and which can last for maybe from 12 hours to 48 hours, depending on the severity, but it is normally lasting within a week. All the symptoms should disappear. There is initial disorientation, there is disbelief, there is not even a lot of attention and concentration is gone, and the person is not fully aware what is happening, and they might get disoriented quite a lot. However, post-traumatic stress disorder is different because it develops after a latency period, which may range from a few weeks to few months, and generally most of the time it should be less than 6 months. If it is more than 6 months, you should specify that the trauma happened on this date and the symptoms started to appear after this time. However, in reality, the person may have suffered some intrusive thoughts in this period, but they may not have gone to the doctor or psychiatrist to get the help in the beginning, hoping that this might be temporary. So you need to explore this. Are these symptoms present within the few weeks to 6 months, or are they happening after 6 months? The course is fluctuating, but recovery can be expected in the majority of cases. However, a small proportion of the cases, the condition may follow a chronic course. That means it may last for years and sometimes whole life. When it depends, when it lasts for a long time, they become part of their personality, with eventual transition to an enduring personality change, which can happen after a serious trauma. Enduring personality change. So then it should be labeled as enduring personality change after a major trauma. The patient must have been exposed to a stressful event or situation, as we described earlier. It could be short, as if somebody has gone to the war, or somebody has a car accident or train accident or plane accident where a lot of people died and the patient survived. Or it is a long lasting, that the person was kidnapped and kept as a hostage for a long period, like prisoners of war. And it should be exceptionally threatening to their life and catastrophic nature in major event, and sometimes events like natural events like earthquakes, volcano, and other things where a lot of people died and the only person survived, and sometimes in war where the people have to migrate, leaving everything behind. They can develop this, which would be likely to cause pervasive distress in almost anyone. There must be persistent remembering, which we call reliving, of the stressor in intrusive flashbacks, and they have very vivid memories, or they got recurrent dreams, or in experiencing distress when exposed to the circumstances. So even if we show some picture or something, the startled response gets there, and they get into the mode where they cannot stay there anymore, feel very uncomfortable, and resembling or associated with the with the stressor. The patient must exhibit an actual or preferred avoidance. So this is another thing. So what happens is the person is trying to avoid any clues, anything that is related to that thing, that resembles the circumstances or even associated with the stressor. which was not present before exposure to the stressor. And either of the following must be present. Number one, there is something, because at that time the stress was so high, and we believe that they must have suffered from acute stress disorder at that time. So there will be some certain things they may not be able to recall, either partially or completely, some important aspects of the period of exposure to the stressor. They may not be able to describe exactly where were they at the time, or they might be, and they may not be able to give more details. Because we believe that they will be in some kind of acute stress where the person completely becomes disoriented, and sometimes they don't remember the event when they are so disoriented at that time. So, persistent symptoms of increased psychological sensitivity and arousal. These were not present before exposure to the stressor, shown by any two of the following. So what happens is there is either difficulty in falling or staying asleep. Remember, this was not present. The person was able to sleep properly before the incident. However, now 6 months later or 3 months later, the person is having those flashbacks, therefore they are not able to sleep. There is irritability, there is outbursts of anger. So even certain things they don't like or they don't want to visit, and if you keep on saying to them, they will become irritable. They can be getting angry and upset and tell you off. And they have difficulty in concentrating. Only two of these need to be present. And they are hypervigilant. They are looking for some other things that people might be after them. Let's say if somebody was attacked by the hammer in their own home, and then he fears going even outside, even in his garden, that people might be coming again, and even slight knock on the door, they will not open the door because they are very hypervigilant and that believe that they might be attacked again. And obviously the exaggerated startle response for anything small, they will get very alert very quickly to defend themselves or avoid the situation or run away from that. Above criteria must all be met within 6 months as we discussed, but in some cases or some purposes, if this is delayed than 6 months, then it should be clearly specified. Now, the main discussion about the PTSD, post-traumatic stress disorder, that mainly it is a psychological disorder, and it is the main treatment remains psychological. The one treatment that is established by the psychologist is the EMDR. This is called eye movement desensitization and reprocessing. So it is a very controlled treatment specialized for PTSD and has been well evidenced in war veterans and is proven to be of help. That must be given a chance. Now the other thing is these patients are very prone to anxiety and depression, and sometimes severe depression with suicidal ideation. If that is the case, they will probably need antidepressant medication. There are certain antidepressants or medications that are licensed to be prescribed for post-traumatic stress disorder. They can be tried. These patients are quite prone to alcohol and use illicit drugs because they might have suffered some kind of physical injury in the process, and they are in pain or discomfort, and they tend to use different medications, and if they can't sleep properly, they will try to use benzos and use alcohol heavily to make them comfortable to go to certain places or at least meet some people outside. But in general, they tend to remain inside, they tend to remain isolated in some ways, and they feel detached from other people and try to avoid any other activities. And so that's the end of it. I hope you understand the basic symptoms that are present in the post-traumatic stress disorder. And thank you for listening. I will be doing some more videos on other anxiety disorders. So please subscribe the channel and press the like button if you like this video and share with your friends. I see you again.